what to expect after we undergo stem cell therapy. Now, umbilical stem cell therapy is generally very safe because it doesn't have the markers to elicit an immune response in the body. Therefore, after taking the stem cell therapy, we will not suffer from any allergic reactions. However, because it is still coming from outside, it is still considered a foreign body. There will be a period where our body, our immune system, will have to identify and understand what these stem cells are coming in for. This period may or may not trigger a few responses. Some of them include mild fever. So fever is technically one of the most common reactions that we see when we administer stem cell therapy. However, it does not last for too long. It is probably there for a few minutes. Sometimes it may be transient. It may come for a couple of days after the procedure, but it's usually very low grade, and usually the fever goes away on its own, so we don't need to take medicine for it. Besides the fever, some of our patients develop a little bit of shivering. They may feel a little bit cold after the procedure. Some patients develop a bit of lightheadedness or slight headache. Some patients develop a little bit of palpitation, meaning the heart beats a little bit faster for a while, but it goes off on its own. Some patients develop a tingling sensation on the fingers and the toes. This could also be related to the circulation of stem cells. Some patients have a little bit of heavy breathing because if you have problems in the lungs, most likely the stem cells will be focusing to the lungs, so therefore you may have a little bit of heavy breathing. But this is about it. So what we see is technically very surface. There are nothing dangerous, or there are no severe outcomes that usually arise after a stem cell procedure. So not much to worry about. However, it is our protocol to observe our patients after the procedure. We will usually observe them for about an hour or two, and some patients, the more chronic patients, will usually be admitted. We will do the procedure in the hospital, where we will observe you for about 1 to 2 days. So this is generally the protocol when we are doing stem cell administration.